For many years, Oxfam's humanitarian team has been working to increase engagement with crisis-affected communities to ensure that their concerns are listened to and to enable them to contribute to the decisions that affect them. Over time, we've learned some valuable lessons about consulting people during disease outbreaks, and in 2018, we developed a new approach called the Community Perception Tracker, the CPT, to better understand the perceptions of communities, particularly in relation to disease outbreaks. The CPT is an ongoing cycle that begins with recording people's thoughts and perceptions on a mobile phone or tablet. The findings are analyzed alongside epidemiological data and then used to make meaningful changes to response programs. The data collected can also be used as evidence for better advocacy and influencing. The CPT was trialed in DRC during the Ebola outbreak, and in 2020 was adapted for COVID-19 and used across 12 existing country programs, including here in North Bekaa in Lebanon. Here, Oxfam and our partner Nabad have been responding to multiple crises. Back in July 2020, when we started using the CPT, everyone was talking about COVID-19. And with the CPT, we were able to quickly see the changes in people's perceptions and use the information to rapidly modify our response. This approach allows us to really listen to what people have to say, without having an agenda in mind or following a structured survey. We listen without judgment during our regular activities like household visits, during distributions, or any information sessions we deliver. In that moment where we stop and listen, we provide a space for dialogue so people feel able to share their honest thoughts. The complexity of the CPT lies within its simplicity. Listening is a skill and not something that we do in passing. We're so used to doing things through structured methods, like surveys, that this new approach feels very different. Everyday conversations with refugees happen all the time, but grasping that those casual conversations can actually make a difference to the program is not easy to comprehend, at least not immediately. One example that truly illustrates how useful the CPT can be is our Vaccine Promotion Action Plan. This stemmed from a single perception from one refugee in one informal settlement in the Bekaa that hinted at the possibility of vaccine hesitancy when vaccines were not yet a topic of discussion in Lebanon. Eventually, the number of perceptions on vaccines started to increase, and our program was ready to respond before the rollout of the vaccine campaign by the government. Being aware of these concerns in advance and throughout the response allowed us to make early adjustments to our activities. As the CPT is used systematically, it provides a quicker and more reliable access to what people have to say. Listening to people is the most important element of any humanitarian intervention, and programs need to be built upon what people say and what people want. This is the true value of the CPT, as this is exactly what it allows us to do.